Hey, you, and welcome to the deep dive. Today, we're diving into something that's probably caused a little bit of panic in almost every pet owner at some point. Acute diarrhea in animals.
Oh, definitely.
It's that sudden onset of digestive upset. The
Yeah.
kind that makes you go, oh no, not again.
It's certainly a very common experience, and, well, understandably, it's something you want to get a handle on pretty quickly.
Yeah,
When your animal isn't feeling well,
yeah.
you want to know what's going on and, what you can actually do about it.
Absolutely. So, our mission in this deep dive is to really unpack acute diarrhea. We're going to explore what it actually is, why it happens, like the different ways things can go wrong in there,
Hmm.
what those key warning signs are that you really need to pay attention to, and the typical approaches vets take.
Right.
We've got some really solid medical information here, so we're essentially doing the heavy lifting to bring you the most important stuff.
And this medical background, it gives us a really solid, structured understanding of the condition, from the initial changes in the gut right through to how it's diagnosed and treated.
Okay, so think back to a time your pet had a bad tummy day. Maybe they sneaked something off the counter, or maybe a new treat just didn't quite agree with them.
Happens all the time.
Right. Then suddenly things weren't normal. We've all been there, I think, in some capacity. Okay, let's get right to it then. What exactly is acute diarrhea?
Simply put, acute diarrhea is when your animal suddenly starts having looser or more frequent bowel movements than usual.
Okay.
The key word really is acute, meaning it's a recent change, not something that's been going on for weeks.
Right, so we're talking about that sudden shift. Now, what's actually happening inside their body to cause this? What's the fundamental reason for that increased fluidity?
At the most basic level, acute diarrhea happens because there's an imbalance in how the intestines are handling fluid.
An imbalance.
Okay. Normally, the intestines absorb water and nutrients and they move waste along. With diarrhea, this whole process gets disrupted in, well, one of five main ways.
Five main ways. Okay, let's dive into those. First up is osmotic. What's the story there?
Okay, osmotic. Imagine the intestines are kind of like a sponge.
Okay.
With osmotic diarrhea, there are too many particles, things like undigested food bits, stuff like that in the intestine that can't be absorbed properly.
Right.
These extra particles, they act like tiny magnets, pulling water into the intestine. So the sponge gets overloaded and all that excess water ends up in the stool.
Ah, okay.
This can happen with, say, a sudden change in diet, or if your pet has trouble absorbing certain nutrients, or even if they just, eat way too much of something.
Okay, the sponge overloaded with particles pulling in water. Yeah, that image makes it really clear.
Ah.
What's the second way things can go wrong?
That's secretory diarrhea. In this case, the intestines themselves are actively sort of told to release more fluid than they normally would.
Told to release. How?
Well, think of it like someone turning on a faucet inside the intestine. This can be triggered by things like toxins produced by bacteria or even signals from the nervous system.
Wow.
And there are also certain substances, we call them secretagogues, which act like messengers, basically telling the gut lining to pump out extra liquid.
So the intestines are actively adding extra fluid themselves. Got it. What's number three?
The third is exudative diarrhea. This one's a bit different. Imagine the lining of the intestine is like a protective barrier.
Okay.
If that barrier becomes damaged, maybe due to inflammation or ulcers, then fluids like tissue fluid, proteins from the blood, even blood or mucus itself can leak out into the intestines.
Oh.
And that obviously increases the liquid content of the stool.
So it's not just a water imbalance, but actual leakage because of damage. That sounds more concerning.
It can be, yeah, depending on the extent of the damage, of course. The fourth mechanism is dysmotility.
Dysmotility. Dys usually means something is off, right? So the intestines aren't moving correctly.
Exactly. Now, what's interesting here is that often with diarrhea, the issue is that the intestines are actually moving too slowly.
Too slowly. Really?
Yeah, or even have stopped moving altogether. We call that ileus. Think of it like a conveyor belt that's completely stalled.
Huh.
Surprisingly, this can also lead to diarrhea because if things aren't moving properly, the normal absorption of water gets disrupted.
Okay, that's counterintuitive.
It is a bit. But sometimes the opposite happens, and the intestines move too quickly. That's hypermotility, which can also lead to diarrhea because there just isn't enough time for proper absorption.
Right.
You see this sometimes with conditions like irritable bowel syndrome, or maybe as a response to something irritating in the gut.
Wow, so even a sluggish gut can cause diarrhea. That's not what I would have guessed at all.
Yeah, the normal rhythm of intestinal movement, it's really crucial for healthy digestion.
Okay. And the fifth mechanism,
Is mixed, which, as you can probably guess.
it's a combo of the others.
Precisely.
Yeah.
It's actually very common to have more than one of these mechanisms contributing to acute diarrhea at the same time.
Right.
For example, you might have an infection that's causing both increased secretion of fluid and some inflammation leading to leakage, that exudative component.
Okay.
So understanding these different ways the gut can be disrupted helps us appreciate that diarrhea isn't just, one simple problem. There can be multiple things going on.
Okay, 5 different ways things can go wrong in the gut itself. Now, diarrhea isn't just about the messy cleanup, obviously. It can actually affect the animal's entire body, right?
Oh, absolutely.
What are some of the key body systems that can be impacted?
Because the gastrointestinal system is so central to, well, hydration and getting nutrients, when things go wrong there, it can have ripple effects throughout the whole body.
Yeah.
The cardiovascular system is often one of the first to feel it, mainly due to dehydration.
Right, losing fluids.
Exactly. Losing a lot of fluid leads to a decrease in the volume of circulating blood. We call that hypovolemia.
Okay.
And you might notice your pet's heart rate speeding up. That's tachycardia. Maybe their gums look paler than usual.
Pale gums, okay.
And if you press on their gums, the color might take longer than normal to return. That's a prolonged capillary refill time, or CRT. Their pulses might also feel weaker.
Mm.
In more severe cases, the loss of electrolytes, especially potassium, that's hypokalemia, can even lead to abnormal heart rhythms or arrhythmias.
Wow, electrolytes are that important.
Oh yeah. Think of them like the body's essential spark plugs. When they're out of whack, it can affect everything, really, from the heart to muscle function.
That's serious. It really puts a strain on the heart. What about other systems?
Well, the endocrine and metabolic systems are also heavily involved. The loss of fluids and electrolytes in the feces can lead to imbalances in things like sodium and chloride, and it can mess with the body's acid-base balance too.
Okay.
Dehydration also puts stress on the kidneys, sometimes leading to a condition called prerenal azotemia. Basically, the kidneys aren't getting enough blood flow to work properly.
Right.
Within the GI system itself, the animal might have abdominal pain. And again, those low potassium levels can actually slow down gut movement even more.
Oh, creating a vicious cycle.
Exactly. And finally, that same potassium deficiency can also cause muscle weakness.
So it's definitely much more than just a digestive issue. It can really throw the whole system out of balance. Now, who is most likely to experience acute diarrhea? Is it mostly a puppy and kitten thing?
Well, while any animal can get acute diarrhea, it is indeed more frequently seen in younger animals like puppies and kittens.
Why is that?
Often it's because their immune systems are still developing, so they're more susceptible to infections. Plus, they tend to be, shall we say, more orally exploratory.
Yes. Dietary indiscretion.
Exactly. They put everything in their mouths. The good news, though, is that in many cases, particularly these younger animals, acute diarrhea is often more likely to just resolve on its own.
Okay.
But overall, it's a very common problem, especially in dogs, again, often linked to their tendency to explore the world with their mouths.
Yes, the canine vacuum cleaner strikes again. So most of the time, maybe an isolated incident isn't a huge red flag initially.
Often. No.
What are the key things then that you would tell us to watch for? The things that signal it might be more than just a mild tummy upset.
That's a really important question. Often, acute diarrhea is self-limiting, maybe just a one-off. Many animals will still seem pretty bright and alert despite, the messy stool.
Right.
However, there are certain red flag signs that should definitely make you more concerned and warrant a trip to the veterinarian.
Okay, what are they?
These include if the diarrhea is accompanied by vomiting, especially repeated vomiting, if your pet seems to be in abdominal pain, like they're guarding their belly or whining when you touch it, if you see blood in their stool, we call that hematochezia, or much less commonly, blood in their vomit hemoptysis. Also, watch out for signs of severe dehydration, like really sticky or dry gums, sunken eyes. Or if your animal is acting very lethargic, just really down and unresponsive. These signs could point to something more serious, like acute hemorrhagic diarrheal syndrome, which we mentioned is more common in dogs and can be linked to things like parvovirus or certain bacteria like Clostridium.
Okay. Those are definitely the things that should set off alarm bells. What about the more everyday observations that might just indicate, standard acute diarrhea?
Well, you might notice your pet having bowel movements more frequently, obviously. And the stool will likely be much looser or even completely liquid.
Right.
They might have accidents in the house even if they're normally perfectly house-trained. You might also see a larger volume of stool overall or changes in its color. Sometimes you might see mucus mixed in or, as we mentioned, streaks of blood.
No.
You might also notice your pet straining to go even if only liquid comes out.
Mm.
That's called tenesmus.
Ah.
And it's also really helpful if you can recall any recent changes. Did they get into the trash?
Mhm.
Sudden change in food? Pick up something weird on a walk? All of that history is gold for your vet.
And what might a veterinarian find during a physical examination? What are they looking for?
The findings can vary quite a bit, depending on how sick the animal actually is. Dehydration and lethargy are pretty common findings, as we discussed.
Mm-hmm.
The vet will gently feel or palpate your pet's abdomen to check for pain, tenderness, maybe thickened intestinal loops, or sometimes other abnormalities like a mass or foreign object.
Right.
They'll also check their temperature. Fever can indicate infection or inflammation, heart rate, respiratory rate, signs of low blood pressure like feeling weak pulses, maybe signs of nausea like drooling.
Okay.
And a rectal examination is also a standard part of the workup. It lets the vet assess the stool consistency directly, check for blood or mucus, and feel for any abnormalities within reach.
So putting together the owner's observations with the vet's physical findings starts to create a clearer picture. Now, we've touched on a few causes, like dietary indiscretion, but what's the full spectrum? It sounds like it could be almost anything.
The list is indeed quite broad, which is why getting that detailed history from you is so crucial for your veterinarian.
Right.
We can generally group the causes into several categories. Dietary issues are super common. That includes not just the obvious dietary indiscretion, eating garbage or non-food items,
Yeah.
but also sudden changes in their regular food, even if it's a high-quality diet. Just
Yeah.
the abrupt switch can cause upset.
Okay.
And some animals also have food intolerances or even full-blown hypersensitivities like allergies to certain ingredients.
Makes sense. What other categories are there?
Well, there are metabolic diseases, things affecting organs like the adrenal glands, that's hypoadrenocorticism, or Addison's disease, or liver disease, kidney disease, even pancreatic disease can sometimes present with diarrhea, either acute or chronic.
Okay.
Then you have physical blockages in the digestive tract. Swallowing a foreign object is a big one.
Like a sock or a toy part.
Exactly. Or conditions like intussusception, where one part of the intestine telescopes into another part that causes a blockage. Or a twisting of the intestines, called volvulus. These are emergencies, obviously.
Whoa.
There's also a condition called idiopathic hemorrhagic gastroenteritis, or HGE. We see sudden, often severe bloody diarrhea, but the exact underlying cause isn't always clear, hence idiopathic.
Okay. A lot of serious possibilities there. And then, of course, there are the infectious agents, the bugs.
Yes, this is a huge category. It includes viral infections like parvovirus, very dangerous, especially in young, unvaccinated dogs,
Right.
but also coronavirus, rotavirus, canine distemper virus.
Okay.
Bacterial infections are also common culprits. Salmonella, Campylobacter, Clostridium species, certain strains of E. coli, and others.
Mm-hmm.
Then we have parasitic infections. You've got the worms, what we call verminous parasites, like hookworms, roundworms, whipworms, tapeworms. And the microscopic single-celled ones, the protozoal parasites, like Giardia, Coccidia, Trichomonas, and Amoeba.
Quite the rogues gallery.
Indeed. We also see rinkettsial infections, like salmon poisoning, which is caused by a type of bacteria called Neorickettsia, found in raw fish in certain areas. And even fungal infections like histoplasmosis, though those are generally less common causes of acute diarrhea.
That's quite a list of potential bugs. And what about things that aren't living organisms but can still cause trouble if ingested, like chemicals or drugs?
Absolutely. Certain drugs and toxins can definitely be a significant cause. This could include heavy metals like lead, certain pesticides like organophosphates, common pain medications like NSAIDs.
Even human pain meds?
Oh, absolutely. Those can be very dangerous for pets. Also, steroids, sometimes even antibiotics themselves, can cause digestive upset as a side effect, and some chemotherapy drugs.
Right.
It's also important to remember that if an animal is already sick with something else, a systemic illness, that problem can sometimes lead to secondary diarrhea. It's not the primary issue, but a consequence.
So when we think about which animals are more at risk, we've already mentioned the younger ones. Are there any other specific groups that tend to be more susceptible?
As we discussed, young dogs and cats are definitely more prone, primarily due to that higher likelihood of dietary indiscretion. the possibility of intussusception happening, swallowing foreign bodies, and just being more susceptible to various infectious agents compared to adult animals with more mature immune systems.
Okay, so a pet comes to the vet with acute diarrhea. What does the diagnostic process typically look like? What can you expect as a pet owner walking in?
The initial steps will almost always include a thorough physical examination, just to assess your animal's overall health status. A fecal flotation test is usually standard, looking for evidence of intestinal parasites, and of course an evaluation of their hydration level.
Okay.
Whether further tests are needed really depends on how sick your pet appears and what other symptoms they might be showing, like vomiting or pain.
What about blood tests and maybe a urine sample? Are those always done?
Not always for mild cases. In many straightforward instances of acute diarrhea where the animal seems relatively okay otherwise, routine blood work, like a complete blood count, CBC, and a biochemistry panel, along with a urinalysis, might come back completely normal, so they might not be done right away.
Okay.
However, in more severe cases, or if the diarrhea isn't resolving, these tests can provide a lot of valuable information.
Like what specifically?
Well, for example, with parvovirus infection, we often see a significant decrease in certain white blood cells called neutropenia on the CBC. In certain types of severe bloody diarrhea, like those sometimes associated with Clostridium perfringens or difficile, we might see hemoconcentration, basically, a higher concentration of red blood cells due to dehydration, but maybe a normal or even low protein level in the blood.
Interesting.
And blood tests are crucial for identifying those electrolyte imbalances we talked about, low potassium, maybe low sodium, low chloride, which can happen due to all the fluid loss in the diarrhea.
And are there more specific lab tests that might be considered?
Yes. Some tests that look at pancreatic function, like SPECT-CPL for pancreatitis, or nutrient absorption tests like TLI, cobalamin, folate. These are more commonly run for chronic diarrhea, but sometimes they can be helpful in getting a broader picture, even in acute situations, especially if things aren't straightforward.
Okay.
There are also highly sensitive fecal tests called ELISA or IFA tests that can specifically detect antigens from Giardia and Cryptosporidium. These are often more sensitive than just looking under the microscope.
Right.
And we now have PCR panels available. These can test a single fecal sample for the DNA or RNA of a whole range of common infectious agents that cause diarrhea, like Salmonella, Parvovirus, Campylobacter, Giardia, etc., all at once.
Wow, that sounds efficient. What about imaging, like X-rays or ultrasound? When do those come into play?
For most mild, uncomplicated cases of acute diarrhea, imaging like X-rays usually isn't needed. However, if there's a suspicion that your pet might have swallowed a foreign object, or if there's concern about some other kind of intestinal obstruction, then abdominal X-rays can be very helpful. They can show gas patterns, or maybe even the object itself.
Right.
If the animal is showing more severe signs, like significant abdominal pain, persistent vomiting, or if the vet feels something abnormal on palpation, then an abdominal ultrasound can provide even more detailed images of the internal organs, the intestinal walls, lymph nodes, and so on. It's better for looking at soft tissue structures.
And what about looking directly at the stool sample itself, like under a microscope? You mentioned fecal flotation.
Yes, fecal flotation is really a cornerstone test. It involves mixing a small amount of your pet's stool with a special solution that makes parasite eggs or certain protozoal cysts float to the top, where they can be collected and examined under a microscope. It's a really important first-line test. Because some parasites aren't shed consistently in every stool sample, it's often recommended to collect and analyze multiple samples, maybe over a few consecutive days, to increase the chances of finding them if they're there.
Good tip.
And as we mentioned, that Giardia ELISA test is very sensitive and is often used along with fecal flotation for better detection, because the cysts can be hard to find microscopically.
Right.
There's also a specific fecal ELISA test available to quickly check for parvovirus antigen in dogs.
Okay.
In some really select acute cases, particularly if there's persistent bleeding or other very unusual signs that aren't explained, a veterinarian might recommend endoscopy. That involves using a small camera to look inside the digestive tract and potentially take small tissue samples, biopsies. But honestly, that's much more common for investigating chronic digestive issues.
Okay, so there's a whole toolbox of ways to try and figure out what's going on. Now, let's talk about what happens once a diagnosis is made, or maybe even while the vet is still trying to figure things out. Treatment. What are the general approaches?
Treatment really depends heavily on how severe the diarrhea is and what the underlying cause is if we've been able to identify it.
Right.
As we've said, many mild cases will actually get better on their own, with just some simple supportive care, may be managed at home.
Okay.
But more severe cases, especially those with significant dehydration or other concerning signs, often require more intensive treatment, which might include hospitalization for things like IV fluids.
What kind of supportive care are we usually talking about, either at home or in the clinic?
Supportive care is really focused on helping your pet's body cope while it recovers. Fluid therapy is often the most crucial part to combat dehydration and correct any electrolyte imbalances.
How are fluids given?
It depends on the severity. It can be done by giving fluids orally if the animal is only mildly dehydrated and importantly isn't vomiting, or subcutaneously, that's under the skin, for mild to moderate dehydration, or intravenously, IV fluids, directly into the vein for moderate to severe cases or animals that can't keep oral fluids down. If blood tests show low potassium, we might need to add potassium supplementation to the fluids, although vets are careful with this, especially during the initial treatment phase for shock.
Makes sense. What else?
Rest is also important. So, limiting your pet's activity, no strenuous exercise, until the diarrhea resolves is generally recommended. Just let their body focus on healing.
And diet. You mentioned bland diet earlier.
Yes, diet plays a key role. For mild cases without vomiting, we usually recommend switching to a bland, easily digestible, low-fat diet for a few days.
Like what?
Common home-cooked options are plain boiled chicken breast, maybe with the fat skimmed off, mixed with plain white rice, or low-fat cottage cheese with rice.
Okay.
Alternatively, your vet might prescribe a special therapeutic intestinal diet that's formulated to be very gentle on the digestive system. The idea is to give the gut less work to do while it recovers.
Makes sense, giving the gut a bit of a break. What about things we can do at home to help prevent future episodes? Is there an educational component?
Oh, absolutely. Client education is a really big part of managing and preventing diarrhea. A lot of it comes down to preventing exposure.
Like,
Limiting your pet's access to things they shouldn't eat, secure garbage cans, keeping human food out of reach, supervising them outdoors to prevent scavenging, making sure they don't eat spoiled food,
vigilance.
pretty much.
Mm.
And for young animals, making sure they complete their recommended vaccination series, especially against things like parvovirus, and are on a regular deworming schedule, is also very important in preventing some of those common infectious causes.
Good point. And when might surgery actually be necessary in a case of acute diarrhea?
Surgery is typically only needed if the diarrhea is being caused by a physical problem that needs correcting, most commonly an obstruction in the gastrointestinal tract.
Like that foreign object we talked about.
Exactly. If something is lodged and can't pass on its own, or if there's an intussusception or volvulus, then surgery is usually required to resolve the issue.
What about medications specifically designed to stop the diarrhea itself? Are there over-the-counter options for pets like there are for people? You know, like Imodium?
There are definitely medications that your veterinarian might prescribe or recommend to help manage the symptoms of diarrhea, but it's really important not to give your pet over-the-counter medications intended for humans without talking to your vet first.
Why not?
Some human medications, even common ones, can be ineffective or even toxic to animals.
Huh.
Loperamide, which is the active ingredient in Imodium, is sometimes used in dogs under veterinary guidance, but it can have side effects and isn't appropriate for all situations or all animals, especially certain breeds, or if an infection is suspected.
Okay.
The medications your vet might use can work in different ways. Some, like loperamide, are motility modifiers. They slow down the movement in the intestines. Others might work by coating the intestines, absorbing toxins, or reducing inflammation.
But not always needed.
Exactly. These symptomatic treatments aren't always necessary, especially in mild, self-limiting cases, and they can sometimes mask an underlying problem or even cause side effects like constipation if used incorrectly. They're usually limited to short-term use, maybe 1-2 days if prescribed.
What about dewormers and antibiotics? It feels like those are often mentioned with digestive issues.
Well, if a fecal test comes back positive for intestinal parasites like worms or Giardia, then yes, specific deworming medication, anthelmintics or antiprotozoal drugs like metronidazole or fenbendazole will definitely be prescribed to treat that infection. Sometimes vets might even prescribe an empiric dewormer like fenbendazole, even if the fecal test is negative, just because parasites can be hard to detect.
Okay.
However, the use of antibiotics for acute diarrhea is a bit more nuanced.
How so?
In many cases of simple, uncomplicated acute diarrhea, especially if it's suspected to be dietary, antibiotics are actually not necessary. In fact, they can sometimes disrupt the normal, healthy balance of bacteria in the gut, the microbiome, and potentially make things worse or prolong recovery.
Right, kill the good guys too.
Precisely. Antibiotics are generally reserved for specific situations, like if there's strong evidence or suspicion of a bacterial infection actually causing the enteritis,
Hmm.
or if the animal is severely ill, showing systemic signs like fever or sepsis, or if they have a very low white blood cell count, suggesting their immune system is compromised, or if there's significant concern about bacteria crossing the gut barrier, for instance, if there's a lot of blood in the feces.
Okay, so more targeted use.
Exactly, not usually a first-line treatment for simple diarrhea.
I've heard a lot about probiotics for gut health in humans lately. Are they also helpful for acute diarrhea in animals?
Probiotics, which are essentially live beneficial bacteria,
Hmm.
can sometimes be helpful. There's some evidence suggesting they might help shorten the duration of mild, non-specific acute diarrhea in some cases, possibly by helping to restore a healthier balance of gut bacteria.
Are they all the same?
Not necessarily. If you're considering giving your pet probiotics, it's generally best to choose products that are specifically formulated for pets, ideally from reputable veterinary or premium pet food companies that have done quality control and research on their specific strains. The quality and effectiveness can definitely vary between products. Your vet can often recommend a good one.
Are there any situations where certain drugs should definitely be avoided when dealing with acute diarrhea? Contraindications.
Yes, absolutely. For example, medications that slow down gut motility, like loperamide or anticholinergics, should generally be avoided if there's any suspicion of an intestinal obstruction, or if the gut has already stopped moving properly, that condition called ileus. Slowing it down further could be dangerous.
Makes sense.
Similarly, some medications might not be appropriate for animals with certain pre-existing conditions, like glaucoma or severe liver disease, and certain drugs might be contraindicated if a toxic cause is suspected, as slowing transit might increase toxin absorption. It really underscores the importance of veterinary guidance.
Definitely. And are there any general precautions we should keep in mind when treating acute diarrhea, whether at home, under guidance, or with the vet?
I think one important thing is to remember that many mild cases will resolve on their own with just supportive care, like the bland diet. So we need to be careful not to immediately jump to extensive diagnostics or overtreat these simple cases. Give it a little time if the animal is otherwise bright.
Right.
Also keep in mind that, just like with people, many medications themselves can potentially cause gastrointestinal upset as a side effect. So if you start a medication and the diarrhea or vomiting seems to worsen, definitely let your vet know.
Good point.
And a specific note for cat owners. Cats metabolize drugs differently than dogs or humans. They can be particularly sensitive to certain medications, like those containing salicylates, aspirin-like compounds. So never give cats human medications containing these ingredients without explicit veterinary advice. Even small amounts can be toxic.
Very important reminder for cat people. Any potential interactions between medications sometimes used for diarrhea that we should be aware of?
Well, it's always important for your vet to know all medications and supplements your pet is taking. One example sometimes mentioned is that long-term high-dose use of metronidazole has occasionally been linked to reversible neurological side effects in some animals.
Oh, wow.
And some animals can have individual sensitivities or even allergic reactions to certain types of medications, like sulfa-containing drugs, which are sometimes used to treat coccidia. So monitoring for any unusual signs after starting medication is always wise.
We've talked about prescription meds and probiotics. What about some of the older, maybe more traditional remedies, like that pink stuff, kaolin pectin? Are those still used or recommended?
Kaolin pectin is an older type of antidiarrheal medication. It basically works by coating the lining of the intestines and absorbing some water and potentially toxins. While it's still available in some over-the-counter formulations for animals, it's generally considered much less effective than some of the other approaches and medications we have today for actually resolving the underlying issues or significantly shortening the course of illness. It might offer some mild symptomatic relief, but it's not usually a primary recommendation anymore.
Okay, good to know. So once treatment has started, whether it's just diet change or includes meds, what does the follow-up typically look like? When should we expect to see improvement?
Most cases of uncomplicated acute diarrhea should start to show noticeable improvement within a day or two, maybe 3, of starting appropriate supportive care or treatment.
Okay.
It's really important for you as the owner to monitor your pet closely during this time. Follow your veterinarian's instructions regarding diet, medications, and activity level carefully.
And if it doesn't get better?
If the diarrhea persists for more than, say, 3 to 5 days despite treatment, Or if your pet's overall condition seems to worsen, at any point they become more lethargic, start vomiting, develop other signs, then definitely contact your vet again. Further investigation or a change in the treatment plan might be needed.
Right.
Also, if parasites were found and treated, your vet will usually recommend bringing in another fecal sample for analysis after the medication course is finished, just to make sure the infection has completely cleared up.
Makes sense. And we've touched on prevention throughout, but just to reiterate, what are the real key practical things we should be doing day to day to minimize the chances of our pets getting acute diarrhea in the first place?
I'd say the most important things are, 1, feeding a consistent, high-quality diet, appropriate for your pet's age and health status. Avoid sudden, abrupt changes in food if possible. Transition gradually over several days if you need to switch. And 2, doing your absolute best to prevent your pet from eating things they shouldn't. For dog owners especially, this often means being extra vigilant on walks, teaching a good leave-it command, keeping garbage secured, keeping potentially toxic foods or items well out of reach at home.
Constant supervision sometimes.
It can feel like it.
Yeah.
And regularly monitoring your pet and their environment for any signs that they might have ingested something inappropriate, like noticing chewed-up items or missing objects, is also crucial for catching potential foreign body issues early.
Are there any potential complications that can arise from acute diarrhea, even if it starts out seeming mild? Something to watch out for.
One potential complication we mentioned earlier, particularly in young animals with severe viral infections like parvovirus or maybe heavy intestinal parasite burdens, is intussusception.
Where the intestine telescopes.
Exactly. The inflammation and abnormal motility associated with severe diarrhea can sometimes trigger one part of the intestine to slide into the section next to it. This causes a very serious obstruction, cuts off blood supply, and almost always requires emergency surgery to correct. It's not common, but it's a serious possibility in certain high-risk cases.
Yikes. That doesn't sound good at all. So, wrapping things up, overall, what's the general outlook? If your pet develops acute diarrhea, what's the prognosis usually like?
Fortunately, the vast majority of cases of acute diarrhea in animals resolve relatively quickly and without major incident. Many cases resolve either completely on their own with just some simple supportive care like that bland diet, or with minimal symptomatic treatment from your veterinarian. So the prognosis is generally very good for most cases of acute diarrhea.
Well, that's definitely reassuring to hear. So just to wrap things up for you listening, acute diarrhea in your animal, as we've heard, can be caused by a huge number of things. It could be as simple as eating something weird from the bin, or it could be a sign of a more serious infection or even a blockage.
That's right.
The crucial thing is to really pay attention to your pet. Be aware of those red flag signs we talked about, like vomiting, blood, severe lethargy, or pain. And definitely don't hesitate to reach out to your veterinarian if you have any concerns at all. Better safe than sorry.
Exactly. And we hope this deeper dive has given you a more organized and clearer understanding of this very common issue. Hopefully it helps you feel a bit more informed and maybe empowered as a pet owner when or if you face it.
And maybe here's something to really think about as we finish. Considering just how many different things can potentially trigger digestive upset in our animals, diet, bugs, stress, toxins, underlying illness, what do you think is the biggest factor, really, that determines how often and how severely our own pets might experience these kinds of problems? Is it more about their individual constitution, maybe their genetics? Is it mostly their environment and what they're exposed to? Or maybe, just maybe, it's influenced by our own habits and vigilance as pet owners. It's definitely something to ponder.
It really is. Lots of factors at play.
Thanks for exploring this topic with us today.